Did you know there's this small butterfly-shaped gland on your neck that controls almost everything? Controls your weight, your mood, your heart rate, and it's called the thyroid. I'm Zeinab. I'm the pharmacist from PillSorted, and I'll explain a little bit more about how it works, what can go wrong, so what are the thyroid disorders, and how do we treat them. In the following video, I'm going to talk about how thyroid can affect your weight. The thyroid looks almost like the size of two of your thumbs stuck together. They come to the other side of your windpipe on your neck, and they're responsible for producing two important hormones in your body. So one of them is called the thyroxine, which is T4, and it has 4 iodine atoms on it. The other one is T3, or triiodothyronine, and it's got 3 iodine atoms on it. What's the difference between these two? T4 changes into T3 in the organs and is the active form of the thyroid. The important thing that thyroid hormones do is they regulate the speed that your body cells work. So they influence the metabolism rate that happens in your body. What that means is if there's too much of the thyroid hormones, all the cells just speed up. They work faster. Your heart rate becomes much faster. Your digestive works faster. So you go into the soft side and diarrhea. You feel anxious all the time. You can't sleep properly. And if there's not enough of the thyroid, everything slows down. Your heartbeat slows down. You feel cold all the time. You get constipated constantly, and you put on weight. Based on these two, the disorders are in these two main categories. So either there is a hyperactive thyroid, which is called hyperthyroidism, or there is an underactive thyroid, so it's called hypothyroidism. There are some other problems as well. For example, thyroid eye disease, that the eyes get too bulging. Most of the time is because of the overactive, but sometimes underactive thyroid can cause the same eye disease. Sometimes there are nodules and lumps on the thyroid. Sometimes pregnancy. So pregnancy messes up the whole system. One of the other hormones that it can affect is your thyroid. But the good thing is usually after pregnancy, thyroid should go back into normal mode. What are the symptoms of hypothyroidism, so the underactive thyroid? The most important one that people come in complaining about is feeling cold all the time. They're really tired, and they've realized they've put on weight around 2 to 5 kilos, so not a very significant, and they're constipated, and sometimes they can't focus. It's hard to get on and move and get something done. So these are the main symptoms of hypothyroidism. Now, what's the symptoms of overactive? Usually people come in with complaining of feeling hot all the time, so they just constantly want to bite on ice, or they haven't managed to sleep at all, so 2 to 3 hours and they're wide awake and they can't go back to sleep at all, or they feel anxious, they can't sit down for a moment, they usually have diarrhea. So these are the symptoms of hyperthyroidism. What controls the thyroid in your body? That's really interesting as well. So imagine you have a central heating in your house and there's a thermostat. So your pituitary gland, which is a tiny little gland, is right under your brain. So it's right behind your eye bone, right under your brain. That works as a thermostat. So it constantly monitors the amount of thyroid there is in the bloodstream. And if there's not enough, it will release a chemical called TSH, or the thyroid stimulating hormone. And the TSH affects the thyroid and makes it create more hormone. So that's how your body adjusts the speed that your cells need to be working. And it wants to keep it in a certain speed, because that speed that the cells work is what we call the baseline metabolic rate. So your body is this amazing dynamic machine that needs to work at a certain speed to make sure all of the functions that you don't really think about are getting done properly. How do we understand if there's a disorder in the thyroid? The good thing is because they're so specific, we can measure these markers. So if you come in with these symptoms, we usually advise on a TSH test. We can measure the amount of the thyroid stimulating hormone. If it's out of bounds, we usually do another blood test to measure the T3 and T4 as well. Sometimes we do all 3 of them together, but it's very specific and you can exactly understand what's going on. So it might be that you plan a couple of tests to make sure that we've got the right amount of the marker measured. So why do they happen? Majority of the thyroid problems are autoimmune actually. So that means our body starts attacking the thyroid gland or affecting its work with no apparent reason, or with the reason that we don't know basically. But that that does mean if there's been a family history of somebody who's having a thyroid problem or other autoimmune diseases, it might be that you get a thyroid disorder too. If the autoimmune disease causes an underactive thyroid, it's called Hashimoto. If the autoimmune disease causes an overactive thyroid, it's called Graves' disease. Having said that, sometimes some medication can cause disorders in the thyroid. So lithium, amiodarone, these two can cause disorders in the thyroid. So we do need to do regular blood tests for them. And how do we treat them? So I'm going to separate treating hypothyroidism, underactive, and overactive from each other. But the one thing that can help with both is actually exercise. The more you exercise and keep moving, it'll help regulate both of your hormones. So for the hypothyroidism, there is levothyroxine. Levothyroxine is a tablet. It's the synthetic form of thyroxine. You take it once a day. It's got lots of different strengths, and depending on your regular blood test, that strength gets adjusted. The things that you need to be mindful of when you're taking the thyroid tablets is these conditions don't have a complete cure. Okay, so you do need to be on them lifelong, and it's once a daily on an empty stomach. Take it first thing in the morning. That's when the best time it'll give you the regulation. So as soon as you wash your face in the morning, take that one tablet and at least give half an hour between eating or drinking anything. So you can have water with the tablet you're having, but don't have tea or coffee with it. Give half an hour between that. Some medicine and some supplements can affect the absorption of your thyroxine, and one of them specifically that comes up quite a lot is the antacids. Things like omeprazole, lansoprazole. These are antacids, and they're usually prescribed to take before breakfast. Now the question comes, which one do I take first? Can I take these together? If you put your levothyroxine the first thing that you wake up in the morning and put the most space between that and your breakfast and your other medications, that's the best thing to do, because the antacids, you can take it closer to your breakfast. So that's the best thing to do. Now, supplements. Some supplements that have iron and calcium can actually reduce the absorption of your thyroxine. So if you're taking supplements, take your thyroxine in the morning, take your supplements around noontime. So 3 to 4 hours, if you can, put between them, and stick to the recommended daily allowance doses for supplements. And one more thing that I wanted to say, iodine is a super essential ingredient for the right work of the thyroid gland. However, you can easily get what you need from food. So don't go for high strength supplements of the iodine, because that will have more adverse effects on it. If your diet doesn't have things like fish, like dairy, like eggs, then you might need some iodine supplement. So that was all about hypothyroidism. So if it's underactive. Now, if it's overactive, what do we do? There is treatments for that too. Carbimazole is the first line that we use. If you're pregnant, we usually give propyltriouracil for it, and it helps stabilize your thyroid function. If the heart rate has gone really fast, we give beta blockers as well to support your heart. And there might be, depending on how severe it is, there are more treatments as well, like radioactive iodine therapy, or even removing the whole thyroid gland. What do you need to look out for? If you feel that your weight is changing, either losing weight or putting on weight, if you feel that your sleep has got really disturbed and you don't have a reason for either of these, if you feel your voice is changing, is becoming hoarse, and if you feel a swelling around your neck, these are the times that you need to get it checked. A recap: there is this small and very effective tiny gland on your neck that controls how fast your body works. The most common disorder is actually the underactive thyroid. Sometimes we have overactive thyroid as well. It's easy to diagnose it with a blood test, and there's a lot of good advice available. So if you have any questions, feel free to reach out to us for that clinician-led health advice. Thank you.